Hi, I'm Lisa McCoy. I'm a registered dietitian with the University of Maryland Extension. And today we're going to talk about the biomarkers of aging. And what that means is we can't really stop the aging clock, but there are some things that we can do to slow down or reverse some of the physical changes that occur with aging. So first we're going to talk about our lean muscle mass. So we start losing that lean muscle mass around the age of 30, and we lose about 3 to 8% each decade. So that means by age 70, we could have lost at least 12 to 24% or more, because unfortunately that lean muscle mass loss increases as we get older. So we're going to be losing more the older we get. So there are some things we can do to help to keep that lean muscle mass, and one of the main ones is to do some kind of weight-bearing exercises, because those weight-bearing exercises actually help to stimulate those muscles and get them stronger, and that's what we need to do. Regular weight-bearing exercises can slow this down, and this could be done through walking, playing tennis, or doing some exercises with weights, with simple light weights, whatever is appropriate for you. So our metabolism is another thing that changes as we get older. And the metabolism means how many calories can we burn? And we all want to know, we want to burn more calories, obviously, to keep our weight. But it declines with age about 2 to 3% for each decade for our metabolism. And the reason for that is that our hormonal changes that occur with aging, and also that loss of lean muscle mass that we just talked about. There are some things that you can do to change that metabolism and prevent so much of the changes in the metabolism. So if you're physically active and you're keeping your muscle mass at a better level, then you're going to actually have a less change in your metabolism, and you're going to burn more calories. We know that muscle burns more calories than fat. So we look at the percentage of muscle to the percentage of body fat. And we want to have less percentage of body fat. Unfortunately, as we get older, that percentage of body fat tends to increase. And the reasons for that is that we tend to slow down, we're not as active as we used to be, and just our body changes, the body shifts, with where the fat is as we get older. So one thing that we can do is trying to increase that activity level, and also to watch our weight and to maintain a healthy weight to help to decrease that percentage of body fat. And the concern with the increase in body fat is it actually increases your risk for several chronic health problems like heart disease, high blood pressure, stroke, type 2 diabetes, arthritis, some types of cancer, and even breathing problems. So the more you can lower that percentage of body fat and keep it in a normal range, the healthier you will feel and be. Another problem that comes with aging is bone loss. We also often hear about people in their older years having osteoporosis and being more prone to fractures when they fall. So bone loss is really critical to be watching as you're getting older. And it tends to happen just because we are not as active, and it's just a natural part of aging. So one way is to prevent that bone loss is making sure that we eat a healthy diet, and that means to have adequate calcium in our diet and vitamin D. And vitamin D mostly comes from the sun, but you can get vitamin D in fortified dairy products, and the dairy products have calcium in them, and that's why they fortify them with vitamin D. The reason is the vitamin D actually helps your body to absorb that calcium. There are some things though that will block that absorption of calcium. One of the main ones is smoking. Smoking, if you're smoking like a pack a day and you've been smoking for a long time, you're not going to be getting as much calcium absorption even if you're eating the foods that have calcium in them. Other factors that can prevent that calcium absorption is an excessive intake of alcohol and high intakes of caffeine or coffee. Like 1 cup a day is not going to influence, but if you're one of these that drinks coffee all day long, then you could be slowing that absorption of calcium by doing that. The other thing that you can do to increase your decrease the bone loss and increase that bone density is actually doing some of those weight-bearing exercises we talked about earlier. And the weight-bearing exercises, we recommend doing those 3 times a week. And that's very easy to do, and a lot of exercise programs that you're probably seeing and videos that are being done here at the Senior Center are some weight-bearing exercises that can be done. One way to check that bone density is to have a bone density scan done on a regular basis. And this is what you need to check with your healthcare provider, because they can give you an idea of how strong your bones are and what the density level is, and then if you need to be taking any kind of medication to increase that density or just making some changes in your lifestyle, and keep an eye on that bone density throughout your lifetime. The next one I want to talk about is our cholesterol levels, and particularly the total cholesterol and the LDL cholesterol. So LDL stands for low density lipoprotein. But you can just remember it as being the bad cholesterol or the lousy. As I think the lousy is a good way to remember the LDL. So the reason they call it the lousy or bad cholesterol is that it's the cholesterol that tends to form the plaques in your arteries that cause blockages in our arteries. So we want to be making sure that those are kept in low enough levels. So one way to do that is to maintain a healthy weight, eating a heart-healthy diet, and that helps to control our blood cholesterol levels. Also check with your healthcare provider, have those levels checked on a regular basis. If you need to be taking medication to control them, then you may need to do that, but that doesn't mean that you need to not do the other lifestyle factors. Those should be done in addition to your medication. One more lab value that you should be monitoring as we get older is your blood glucose level, because that does tend to rise as you get older. And one of the reasons is that as we get older, our bodies just start wearing out, getting tired, and we may not be producing as much insulin as we did before, and that may cause the blood glucose level to increase. Another reason is we talked about that increase in body fat and increase in weight, and when we have that interferes with the absorption of insulin into our cells. So losing a little bit of weight actually may help to get your glucose level to a normal level. So it's important to get that level checked regularly and to maintain a healthy weight, make smart choices, make heart-healthy choices, and then also getting enough physical activity. So the bottom line is, first of all, we need to stay active. This includes not only doing aerobic exercises, but also some weight-bearing exercises, some strengthening exercises that you can do to increase that lean muscle mass. Another one is to maintain a healthy weight. If you need to lose a few pounds, then try to lose a few pounds, but just trying to maintain a weight that's healthy for you and making smart choices when you eat. And the important thing is to have a regular checkup with your healthcare provider and make sure that you're monitoring those lab values that are important, like the lipid levels, the cholesterol and triglyceride levels, and also the blood glucose levels. And having that DEXA scan or bone density scan done as recommended. If you've never had one done or if it's been a while, then it might be a good idea to call your healthcare provider and see when they recommend having that done. So doing these things can actually help you to preserve your independence, your physical function, and your quality of life, and it may also help to lower your healthcare costs.